Biomarkers versus clinical symptoms, enhancing disease diagnosis. Biomarkers versus clinical symptoms, enhancing disease diagnosis. Introduction. Disease diagnosis has come a long way over the years, thanks to advancements in medical research and technology. Traditionally, clinical symptoms have played a crucial role in diagnosing different diseases. However, the emergence of biomarkers has revolutionized the field. Biomarkers are measurable indicators of biological processes or conditions, which can be detected in biological samples such as blood, urine, or tissue. In this article, we will explore the importance of biomarkers in enhancing disease diagnosis, and how they complement or even surpass clinical symptoms. The role of clinical symptoms in disease diagnosis. For centuries, physicians have relied on clinical symptoms exhibited by patients to diagnose various diseases. Symptoms are subjective experiences reported by patients, such as pain, fatigue, or abnormal body temperature. Although these symptoms can provide valuable information for diagnosis, they often lack specificity and can overlap across different diseases. This creates a challenge in accurately identifying and differentiating specific conditions solely based on clinical symptoms. Moreover, clinical symptoms may not manifest in the early stages of a disease, making early detection challenging. For example, some cancers may not present any clear symptoms until they have reached advanced stages, making treatment less effective. In such cases, relying solely on clinical symptoms delays diagnosis and potentially affects patient outcomes. The rise of biomarkers. Biomarkers offer a promising alternative to relying solely on clinical symptoms for disease diagnosis. These biological indicators can provide objective, quantitative, and measurable data about the presence, severity, or progression of a disease. Biomarkers can take various forms, including genetic, proteomic, metabolic, or imaging markers. One of the key advantages of biomarkers is their ability to detect diseases at an early stage, even before clinical symptoms manifest. This early detection can significantly improve patient outcomes and increase the chances of successful treatment. For example, certain biomarkers can aid in the early detection of diseases such as Alzheimer's or Parkinson's, allowing for timely intervention and potentially slowing down disease progression. Biomarkers versus clinical symptoms, complementing each other. While biomarkers may offer advantages in disease diagnosis, they do not replace the importance of clinical symptoms. In fact, both biomarkers and clinical symptoms complement each other, providing a more comprehensive picture of a patient's health. Clinical symptoms can provide crucial initial insights into a patient's condition, prompting further investigation and testing. Physicians use symptoms as a starting point to determine the potential underlying diseases or conditions warranting more specific diagnostic tests. Moreover, some conditions may not have well-defined biomarkers yet, and in such cases, clinical symptoms remain essential for diagnosis. On the other hand, biomarkers can help validate and confirm clinical suspicions. They can provide objective evidence of the presence or absence of a particular condition. The importance of biomarkers in precision medicine. Biomarkers play a critical role in tailoring medical interventions to suit specific patient characteristics. By identifying biomarkers unique to a disease or patient population, physicians can better understand disease subtypes and select appropriate therapies. For example, in cancer treatment, biomarkers such as HER2/NOI or PD-L1 expression are essential for determining eligibility for targeted therapies or immunotherapy. By identifying these biomarkers, physicians can personalize treatment plans, improving patient outcomes and reducing unnecessary exposure to treatments that may be less effective. Challenges in biomarker implementation. While biomarkers show great promise in enhancing disease diagnosis, their implementation faces certain challenges. One significant challenge is the need for standardized and validated biomarker tests. Biomarker tests should undergo rigorous validation processes to ensure reliability, accuracy, and reproducibility. Without standardized tests, there is a risk of false positive or false negative results, leading to misdiagnosis or inappropriate treatment. Another challenge is the cost associated with biomarker tests. Developing and implementing biomarker tests can be expensive, affecting their accessibility and widespread use in clinical practice. Efforts to reduce costs and improve the availability of biomarker tests are crucial for their effective utilization in disease diagnosis. The integration of biomarkers and clinical symptoms has significantly improved disease diagnosis and management. Clinical symptoms have long been the basis for identifying and diagnosing various diseases. However, relying solely on symptoms can lead to misdiagnosis and delays in treatment, especially in cases where symptoms are nonspecific or do not manifest until a disease has progressed. This is where biomarkers play a crucial role. Biomarkers provide objective, quantitative, and measurable data about the presence, severity, or progression of a disease. They can be detected in biological samples like blood, urine, or tissue. One of the key advantages of biomarkers is their ability to detect diseases at an early stage, even before clinical symptoms become evident. Early detection is vital for improving patient outcomes and increasing the chances of successful treatment. For example, biomarkers can aid in the early detection of diseases like cancer, allowing for timely intervention and potentially better treatment outcomes. However, biomarkers do not replace the importance of clinical symptoms. Instead, they complement each other. Clinical symptoms serve as the initial indication of a patient's condition, prompting further investigations and tests. Physicians use symptoms as a starting point to determine the potential underlying diseases or conditions that require more specific diagnostic tests. In cases where well-defined biomarkers are not yet available, clinical symptoms remain essential for diagnosis. On the other hand, biomarkers provide objective evidence and help validate clinical suspicions. By confirming the presence or absence of a particular condition, biomarkers complement clinical symptoms and guide appropriate treatment decisions.